Good morning, all learners. Am I audible? Great, great. So we are starting with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर इतना कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. We are giving tribute to our great master Samuel Hahnemann for giving this divine science to all of us and teach us dare to be wise. Seeking blessings from our Guru Dr. Prafull Vijayakar sirs, who have bridged this homeopathy with the modern science and made homeopathy very easy like mathematics. Thank you, sir. जय हनुमान जय होम्योपैथी ओम विजय कराय नमः. Friends, up till now we have completed two books. One is Theory of Suppressions and another one is Modern Science and Homeopathy, along with the single aphorism of the organon of medicine from Master Hahnemann. So today we are going to start our journey of the third book of Dr. Prafull Vijayakar, the end of the My Assumptions of Miasms. Before we are reading these books, we are starting with the Organon six editions, few aphorisms, and after that we are shifting to the books of Miasm. So the up till now we have read 34 aphorism. In this aphorism, many things was mentioned by the masters, and in the last aphorism, it was like that natural disease cannot be cured without the aid. So there are certain possibilities. So after that, the aphorism number 35 state these things. So we are reading this with this process. Aphorism number 35. In order to illustrate this, we shall consider in a three different cases. There are three possibilities as well what happen in a nature when a two dissimilar natural disease meet together in one person, as also the result of the ordinary medical treatment of the disease with unsuitable allopathic drugs which are incapable of producing an artificial morbid conditions similar to the disease to be cured, whereby it will appear that even nature herself is unable to remove this similar disease already present by one that is unhomeopathic, even though it be stronger, and just as little is the unhomeopathic employment of even the strongest medicines ever capable of curing any disease whatsoever. So this is what we have learned in our medicines, that our medicines produce a artificial disease in the body. It is stronger than the natural disease, so that the medicine can remove the natural disease. But nature herself does not remove the disease if the disease are stronger in that. Aphorism number 36. What are the possibilities? If the two dissimilar diseases meeting together in a human being be of equal strength, or still more if the older one is stronger and the one disease will repel by old one, new one will be repelled by the old one from the body and not allowed to affect it. For example, a patient suffering from a severe chronic disease will not be infected by a moderate autumnal dysentery or other epidemic disease. The plague of a Levant, according to the Larry, does not break out where scurvy is prevalent and the person suffering from eczema are not infected by it. These are the example which was given by the master. We will, when we learn the miasm theory and the understanding of miasm with the modern science, we can understand that if the person is in a certain defense mechanism, like a psychotic or a syphilitic defense mechanism, then and then they will not suffer from some of the psoric ailments. So that is why you have to understand that these are the process. For example, rachitis prevent vaccination from taking effect. These all are the observation of the Master Hahnemann and the time when the Master Hahnemann was practicing the observation of the many other authors. Those suffering from the pulmonary consumptions are not liable to be attacked by the epidemic fever of a not very violent character, according to one hidden brands. So these are the examples. So aphorism number 37 says that so also under ordinary medical treatment, and old chronic disease remain uncured and unaltered if it is treated according to the common allopathic method, that is to say, with the medicine that are incapable of producing in healthy individual a state of the health similar to the disease, even though the treatment should last for years and is not of too violent character. This is a daily witness in practice. It is therefore unnecessary to give an illustrative example. So, but if treated with the violent allopathic medicines, the other disease will be formed in its place, which are more difficult and dangerous to life. So this is what very important line it was written, that whenever you are prescribing an unnecessary allopathic medicines, what the other diseases produce, and that other disease is nowadays called as iatrogenic disease, the disease which is produced by artificial medications. It is a daily occurrence what Master Hahnemann is telling us. So now we are shifting to our journey of the book, The End of My Assumptions of Miasm. Anyone have idea about this book, or just we are reading this book, and I will share a few of my examples with this book so that we can learn together, and those who have any experience of miasm, they can also share in the group chat. Okay, so we are starting with the journey of my assumption of miasm. Look at the first page, it will help you to understand that this page is giving you a guide, and we are reading also this, understanding this page also. Hope the screen is visible to all of you in a better way. So we are starting with the one of the best poem by Bernard, George Bernard Shaw. This is true joy in a life, the being used for a purpose recognized by yourself as mighty one, the being of a force of nature instead of feverish, selfish little clod of ailment and grievances, complaining that the world will not devote itself to making you happy. I am of no opinion. I am of the opinion that my life belongs to the whole community, and as long as I live, it is my privilege to do for them whatever I can. I want to be thoroughly used up when I die, for the harder I work, the more I live. I rejoice in life for its own sake. Life is no brief candle to me. It is a sort of splendid torch which I have got hold of for the moment, and I want to make it burn as brightly as possible before handing it on to future generations. So this why this Bernard Shaw has given this wonderful, because Bernard Shaw says that your life is not for yourself. You have to create your life, and if you want to rejoice your life, you have to learn something from the nature and give it back to the nature. So this is what they are. So I need to use my life for the purpose of benefits of others. So same way what Master Hanemans and Dr. Vijayakar is telling, that sharing is always caring. So once you learn something, you share with your colleagues and friends and everyone, so that this is what your purpose of life is gaining, and you are improving day and day. And this is what Bernard Shaw says, that when you are light up at with the candles, so that you can bright the future generation. That means what I am doing right now, and what Sir has doing, that Sir has giving a knowledge to us, and what I am doing is I am also giving the same thing to all of you for future generations. It was written by the George Bernard Shaw. Now we have to understand the concept of this, and why Sir has put this book name as this. So look at the first page. Again, we go back to the first page, that is the front page. What you see in this page? It was written the predictive homeopathy, the part 3, the Prafull Vijayakar, the name, the end of my assumptions of miasm, then the clock, then the genes, then the cells, then the aging process from the child to the adolescence to the adult, middle aged, and the old aged. So about the cover page, this cover page comprises of the predictive homeopathy part 3. It elaborates the thoughts of the author and it has been designed by the author and executed by the artist Bhushan Vijayakar. So the name of the book, The End of My Assumptions of Miasm, a cell in the background, a clock of the human age, the miasmatic stage of man, the chromosome. The screen share is not visible. Okay, fine, great. So the cell in the background, the clock of human age, the from miasmatic stage of the man, the chromosome, the subtitle, mathematics of the human. Yes, that is what I am showing you the front page only, Dr. Nisha. You have to look into it. And then I am reading. Yeah, great, great. So I am reading the front page only. I am explaining you with the visualizations. Okay, great. The subtitle Mathematics of the Human. Again, we will start with the first. So the cover page consists of the name of the book, the end of My Assumptions of Miasm, the cell in the background, the clock of the human age from the childhood to the old age, the chromosomes, the subtitle Mathematics of the Human Defense Against the Disease, and the color. The name of the book, End of My Assumptions of Miasm, is almost about the miasm, which have been the most misunderstood and misconceived part of the homeopathic study. The name has been coined out of a combination of the two words miasm and assumptions. The author wishes that the science in this book will put the end to all the assumptions and presumptions about the miasm and hence the name My Assumptions. The explanations are based on the study of the unit of life, the cell, and hence it is from the background. Man's life has been depicted in a three important stages on the clock, which represent the lifespan of the man. The three important stages are based on the defense mechanism of the man at the cellular level. There is a genetic control over all these defenses, and hence the depiction of chromosome in the background. All this is genetically governed and mathematical if understood properly, and hence subtitle Mathematics of the Human Defense Against Disease. Color scheme. The color used are red, yellow, green. The color of the signals. The green stand for the going on, the yellow stand for slowing down, and red stand for the stop, which somehow similar to the miasm, sora, psychosis, and syphilis. So this is what all about the first page. Okay, so that is what I am showing you. Now I am going to give you a brief about the authors, what is author is. So the secret of success, says Dr. Vijayakar, is the secret of success, says Dr. Vijayakar, is that I have tried to bridge the human-related sciences with the recent advances and the homeopathic science. Dr. Vijayakar happened to be the first homeopathic physician in the world to have gone into the depth of embryology and tapped the significance of the Hering's law. This is a very big contribution that he has made to the field of homeopathy. A solid scientific base has been given to this magnificent science. This interpretation is put in the form of his chart of separations. He is the first homeopath to show his failure in seminars and point out how homeopathy can also cause very bad separations when practiced in a wrong way. The chart beautifully illustrates how disease progresses gradually from one system to another and how the reversal takes place in the cure. It serves as a clear-cut guide in a practice. It is said that the modern medicines has progressed, homeopathy is based on the principle which are rock solid, but it is not understood by the people. In addition to being the first homeopath to show his failure in his seminar series, he is also one of the few homeopaths to invite questions. The fastest constitutional prescriber, a quick good look at the patient, his body structure, his body language, and his diagnosis of the patient's remedy is ready as soon as the patient enter and start talking. He is also the largest crowd puller to the seminar in India today. He stand a record of 1150 people attending his 3 day seminar in Punjab. Firm and sound knowledge of homeopathy and the human related sciences, an inquiring and questioning mind, keen observations, ability to synthesize the information gathered faster than any computer, a brave heart, die-hard confidence in himself and in a homeopathic system of medicine, and above all, the patient to see beyond the ordinary and then to perceive and find an explanation, an answer. This is what has led Dr. Vijayakar to an extraordinary success. Homeopaths around the world and homeopathy itself has to gain from this charismatic man. It is not without any reason that he has been nicknamed the Lion of Homeopathy or the Einstein of Homeopathy. He always says, let's grow together and let us march toward the unity of homeopathy. That is what Sir always says, let's grow together. What we are doing is, let's go together and let us march toward the unity of homeopathy. We are not reading the acknowledgement as we are highly thankful to Sir for giving this wonderful science to all of us and giving us the insight into and those who have contributed in this field and making this book available for all of us. So we are highly thankful for all of them. Whenever we are reading any book, we need to read the preface first so that we can understand what the book is telling us. So this is what we are reading the preface of this book. The name of this book has been coined as the end of my assumptions of miasm. This is not such word as my assumption, but it is the word derived from the combinations of the miasm and assumptions. The first two letters, my, literally means mine. In short, the theory which I herewith propose in this book has been based on the firm scientific fact. The study of the modern advances made in pathology and embryology has helped to decode the actual meaning of what Hahnemann could have meant by miasm. The application of this knowledge has helped me to unravel the mysteries of miasm and thereby help me to get fantastic results in incurable cases or cases with grave pathologies. This knowledge has undoubtedly helped me to do away with all the assumptions which I had about this subject. They say when you assume things, you make an ass out of you and me. This has been happening in homeopathic world for a long time and is perhaps the reason why homeopaths do not have credibility amongst other therapeutic science. This is also the reason why homeopaths do not get consistent results. Whoever had good knowledge and command over the subject of miasm never tried to relate it to the modern science, and if they ever did, they never tried to propagate it or share it with others. Because of this, many people have tried to distort the meaning of this sacred word miasm, converting it to fantasy with the ulterior motives. Dr. Hahnemann, in the preface of the first edition of Prominence, says, if I did not know for what purpose I was put here on the earth to become better myself as far as possible and to make better everything around me that is within my power to improve, I should have to consider myself as lacking very much in a worldly prudence to make known for good of the people an art which I alone possess and which is within my power to make as profitable as possible by simply keeping it a secret. to keep an art which he only possessed as a secret to rack the profits and become successful alone, he thought was not worldly prudence. The human mind feels within it the irresistible, harmless, and praiseworthy impulse to give some account to itself as to the mode in which the man accomplished good by his actions. So, what Hahnemann has written these lines of explanation not to satisfy any critics, but in order to present the homeopath another and more probable attempt towards an explanation. By the above statement, what Dr. Hahnemann felt and we learn, every attempt is to be made to give account of the mode in which human being functions. If one does get the knowledge of the applications of any branch of the science of homeopathy, it is not prudent to keep it secret and it should be shared with the fellow homeopaths. Keep in mind, friends, if you know something and if you have any experience in your life, and if you keep that experience secret, it will not going to help you in the future. So once you learn something, you share with your colleagues, share with your friends, so that the nature will get back to you and give you more things. Both this above virtue contribute to make everything better around us that is within our power to improve. With these three objects in mind, I proceed to put forth an explanation to the ever debatable, ever confusing doctrine of miasm. Though thoroughly scientific, a touch of philosophy which induces logical thinking may give it a line of deductive hypothesis. It is timely to recall that 50 years ago, Frederick Goehl's Hopkins, a famous human biochemist, stated the task of the human biochemist or a scientist wishing to get to the heart of the problem is exceptional. He must study the system in which organizations of the chemical event count for more and is carried far beyond that of non-living systems due to high organization. Such high organization cannot depend upon mere presence of concentrations and structural distributions among specialized colloidal catalysts. But he says, I think, in a feeling, sure such factor contribute to that organizations make a significant senses. Thus, the human biochemist, in describing the living system, comes in a contact with the philosophical thoughts. He further adds current philosophy is busy in emphasizing the truism that the property of the whole do not merely summarize but emerge from the property of its part. That chemical data can throw some real light on the nature of the organism, which in its very essence is the unit. So, what is that philosophy that the biochemist said that everything is the property of this whole organization is the property of the one unit. So same thing, the property of the whole human being is the property of the one single cell, and this is what we have to understand the cell. The biologist has long studied living organism as a whole with ever increasing interest, but these studies can tell us nothing of the nature of the physical basis of life, which no forms of the philosophy can ignore. He further states it is necessary for a biologist and biochemist or whoever is interested in working and existence of the human being, even if it is a homeopath, that the data collected by them by means of the science be related with the activity of the organism as a whole. So same way it was written in aphorism number 189 by the master Hahnemann that without the cooperation of the whole or rest of the whole does not cause any disease in the body. So that means that every cells in our body is interconnected and it has interplay. So the whole is represented by a single cell. Dr. Dr. Hahnemann expressed the limitations of the science prevailing during his time. दरवाजे बंद कर दीजिए. Dr. Hahnemann expressed the limitations of the science prevailing during his time. At the same time, he warned us by his foresight that whatever changes we observe in the living organism subject, human being, only one of the many, and whatever changes we see in them in terms of symptoms expressed by the disorder organs and the systems cannot be by any means lead us to the explanations of what is wrong within them. This he categorically stated because he was sure that whatever was happening at the cellular and molecular level, that is deep within the depth of man, is certainly a different process, and this is he could not explain because during this time science has not advanced enough, nor were electronic microscope discovered to unravel the mysteries. This was why he rightly criticized the allopathic approach of treating the disorder system or organ, neglecting the tissue and cell which forms them. And what a pity that this science is still at the same superficial level of treating systems or organs, even when science has advanced in a leap bound. Homeopaths have been treating cases of the cold, cough, skin disease, and arthritis with ease, but their limitations have incidentally remained the same as their allopathic counterparts. The cases of diabetes, hypertension, cancers, and AIDS do not respond to their treatment. Then, what was the great idea of proposing a new science which Hahnemann did if the limitation were to remain the same? This means the homeopaths have missed on the something important and not understood something which Hahnemann wanted to convey. So, if we have only limited number of treatment like a cold, cough, arthritis, and everything, then what was the use of the science? So the homeopath do not understand something which is Hahnemann wanted to convey. Now the science has advanced to leap and bound. We can now understand the human being very deeply, even at the cellular, molecular, and the genetic level, which of course forms a part of the whole. A holistic homeopath cannot afford to neglect such an important aspect of the human being. This has been perhaps an obstruction to the progress of such a mathematical and universal science of the homeopathy. Thus, with the above dictate, I am humbly trying to correlate certain well-known principles of the physics, chemistry, biology, genetics, immunology, human biochemistry, and embryology and to try and simplify the doctrine of miasm so that it may be of help to the youngster as it has undoubtedly helped me in curing the higher level grave disease with the pathological changes and bring homeopathy out of its malign means the symptoms or mental relieving camouflage outfit. This knowledge has certainly helped me to end my assumptions of miasm, and I sincerely hope it does the same for you too. So, this is what the preface by Dr. Prafull Vijayakar. So, we are starting with the chapter 1. We will continue this series and we are reading up till 7:45, and after 7:45 we will have a discussions or any question answer sessions. Okay. Chapter number 1, Experience is the Best Teacher. So, about 20 years back, I was called upon to treat a case of 65 years old lady lying in a hospital in a semi-comatose condition. It was not an easy job for a young, recently graduate homeopath. So, this was a story in almost around 1984. Okay, in 1984, sir was called to see a old lady. So, sir says that despite the nervousness, I accepted the invitations and visited the lady in the hospital. I saw this lady lying in a semi-comatose condition, not responding to any of my queries and compounding to my difficulties. I was told that she had gone into these conditions after an attack of the high fever and plenty of the loose motions. She was lying down still with the eye closed. Suddenly she started shouting and shrieking. Hold me, my head is sinking, my legs are going up, I am sliding down. After thorough inquiry with the relatives, I found that this was a regular feature, at least for last 3 days. This type of the shrieking was occurring at least 6 to 7 times in a day. I took a complete history and went home with the instruction to the relatives of the patient that they have to come and collect medicine from my clinic in the evening. I work hard on the case with my repertory and referring the books on materia medica, and I prepared myself to give a good remedy to her in the evening. In the evening, nobody turned up and take the medicines. Next day too, none of the patient's relative came. 3 days later, I learned that the same patient was seen by the senior homeopathic physician who prescribed on the spot, and the patient recovered even as I was deciding upon the remedy. I contacted the physician later and asked him what medicine had cured the lady. This was to enrich my knowledge. I was told she had been cured with the Hellebores. The physician told me that whenever there is a case who is unconscious and comatose and the patient starts shouting or shrieking, one should observe the extremity. If the extremity shows a jerky movement or a convulsive movement, it indicates cerebral irritations, and the remedy which may be indicated are Hellebores and belladonna. I was happy I had learned something. Quite a few years later, I was called upon to deal with the case which was in a similar conditions, only the cause was a difference. The case was that of the advanced astrocytoma with a hydrocephalus. The symptoms were almost the same. The patient, a male aged 37 years, was shrieking for a while and receding into stupor. I gave belladonna single dose. There was no change. I changed to Helleboros. Again, there was no change. I tried repeated doses of the belladonna, yet there was no change. The patient succumbed to the illness and died. Later, as luck would have it, one of my assistant doctor again presented me a case of a male who had identical symptoms, stupor interrupted with the screaming. This time the stupor was because of the cirrhosis of the liver, and the patient was in the hepatic coma. Belladonna was prescribed by her, the doctor. The patient came out of coma. This was all the improvement she got from the belladonna. Even repetition did not help. The patient did came out of the coma, but could not talk, could not move his limb. He led a vegetable life until after 3 months of the trial and error, and he breathed his last. Now, the question which arises in our mind. Many a time it happens with all of us. We learn something from the seminars. We have seen a cases like a seminar shows a case, and we understood that yeah, this was this remedy, and the same case arrived to us, and we prescribe the same remedy with the failing result. It happens. Hope you all have the such experience. Those who are the practitioners. Okay. Now, what was the questions? The questions which arise in our mind is that if homeopathy is based on only symptom prescribing, why should it work in one case wonderfully as in the first case, and why should it fail in the second case? And at the same time, why act partially in the third one? The prescribing factor in all the three cases were the same as the symptoms. The result in all the three cases were different. Why this is? So this is what Hahnemann's is. The question is like this. Now, what was the Hahnemann's experience? Hahnemann stated in aphorism number 176. There are, however, still a few diseases which, after the most careful initial examinations from aphorism number 84 to 98, present but one or more too severe violent symptoms, while all the others are but indistinctly perceptible. In aphorism number 177, Hahnemann says, in order to meet most successfully such a case as this, which is very rare occurrence, we are in the first place to select, guided by these few symptoms, the medicine which in our judgment is most homeopathically indicated. In aphorism number 179, more frequently, however, the medicine first chosen in such a case will be only partially, that is to say, not exactly suitable, as there was no considerable number of symptoms to guide to an accurate selection. Thus, Dr. Hahnemann himself has advocated that in cases like coma, where Not many symptoms are available. The presenting one or two severe violent symptoms can be made use of to prescribe. In the above three cases, the stupor alternating or interrupted by the shrieking was the prescribing symptom. So far, so good. But yet, it does not give a desired result. Now, what Hanuman says said in aphorism number 170, we should select, guided by these symptoms, the medicine which, in our judgment, is most homeopathically indicated. Here he had made it amply clear that it is just not the symptoms, a severe violent symptom which are going to be the base of our prescriptions. These symptoms or a group of symptoms can only guide us to find the simillimum. These symptoms only help us to show us a group of remedies which can come into play. Now we have to use our judgment as to which homeopathically indicated. This judgment will come from the primary knowledge of what is homeopathicity. So homeopathicity include not only similia similibus, which literally means symptom similarity, but also something more. What is something more from the learning from this Hahnemann's experience? So this is what Master Hahnemann is telling us. We have many a time it came across in our clinic also. So we have a PQRS symptoms, and that PQRS symptom consists of the two, three, four remedies, and now we have to judge ourselves which remedy to be prescribed on the cases. So in above cases, we have seen that the first case was the physiological case, the second case was the structural cases of the astrocytoma of the brain, and the third case is of the structural case of the liver. So what to target? The symptoms is the indication, but what organ has been affected in this case has to be targeted. So what Hahnemann telling in this experience? So learning from Hahnemann's experience, in the last cases where the patient of the hepatic coma came out with the belladonna only to lead a vegetable life for the 3 months, the very fact that the patient came out of the comatose condition means the remedy was simillimum to that state of coma, particular that coma. The fact that it removed the comatose conditions means probably it corrected the metabolic encephalopathy or reduced the cerebral edema, which happened even with the intravenous drip of mannitol or steroids. The cause of metabolic encephalopathy, which is in this case was the cirrhosis and was not controlled, and the liver went on getting damage, and disease went on increasing, and the patient died. So here we need to target the liver. So homeopaths so often face a similar problem in other cases too. The case of acute renal failures are treated by the good homeopath with the most well-selected simillimum. The patients report sensation of well-being. After the best selected simillimum, patient improve very well and develop a tremendous faith in the homeopathy and the homeopath as well. Even the serum creatinine and the blood urea nitrogen level reduce in the first few weeks of the treatment. Patients confess that they sleep better, eat better, and even resume their office work or the business. But these happy circumstances do not last, and the patient gradually slide down in the health. He start losing weight, his blood pressure goes on gradually increasing, he start becoming edematous, serum creatinine and blood urea increase gradually, and he start feeling weakness. All this deterioration, despite the right remedy, is unbelievable for the homeopath. He insists that his remedy gave a patient a general sensation of the well-being, good appetite, good sleep, etc. And hence it was the right simillimum. Then why? Why should the patient and his kidney deteriorate? The fibroid of the uterus, tumor benign or the malignant in the skull or the abdomen, the atherosclerosis of the coronary arteries or the cerebral arteries are peculiar diseases. One finds that the patient says, I am much better even ever since I started your treatment, and yet he deteriorates gradually but surely to make a mockery of the principle of similia similibus curanter. You know? In all the above cases, $1 million question is, has the homeopathic principle of similia similibus its own limitation? First, should it only be used of the physiologically reversible disease and fail in the more dangerous and the terminal disease? But then we have heard of so many incurable cases reverse. We have heard and read of the miracles in homeopathy. Why then are the miracles cures are so rare? Or are they accidental? In short, what are the reasons for the failure of homeopathy? Why do homeopaths who boast of the being good interpreters of human mind and having fantastic analytical brain to discover and invent newer and newer remedies do not know how to cure a case of cancer with the sulfur? The answer of the above questions is in the one aphorism of Dr. Hahnemann's in aphorism number 205. It stated, homeopathic physicians never treat one of these primary symptoms of the chronic miasm, nor yet one of their secondary affections that result from their further development by local remedies, but he cures in cases where one or the other appears only the great miasm on which they depend, whereupon its primary as also its secondary symptom disappear spontaneously. He further writes that the primary symptoms are destroyed by the allopathic physicians. The hypertension, which was the cause of the renal failure, was suppressed by the allopathic suppression, thereby removing the primary reactions of the organism and worsening the secondary reaction, that is, of destruction of the kidney. So let us see what happened at physiopathological level. The narrowing of the renal artery causes reduced blood supply to the kidney. The kidney, which are now striving for the less nutrient because of the less blood supply, in turn ask for the more. In response to the organism as a whole, react by the feedback mechanism and order the heart to pump blood with the greater pressure into the narrow arteries so that the optimum blood supply to the end organs is maintained. But the allopathic physicians, as also an ill-informed homeopath, try to reduce the hypertension with the local remedies, which are called antihypertensives. The very idea of the organism to defend its end organs by increasing the pressure now stands defeated. The kidney now receive less than optimum blood supply and hence less nutrition. Thus, it starts getting degraded. The kidney parenchyma gets destroyed not because of hypertension but because of lowering of the blood pressure, and the patient is now ready for dialysis. Thus, the primary course of the atherosclerosis of the blood vessel caused by the psychosis miasm goes untreated and the disease progresses and the patient dies. Again, in aphorism number 205, he further adds, the homeopathic physicians find that primary symptoms have already been destroyed, and he has to now deal with the secondary ones, that is, affections resulting from the breaking forth and the development of this inherent miasm, but especially with the chronic disease evolved from the internal sora. Here he refers the reader to the theory of chronic disease. Thus, he makes it amply clear that any chronic or terminal or a grave disease cannot be treated without underlying miasm being taken into consideration. So, that is what we have to understand from this perspective. When uses the word homeopathicity, he means it is not only symptom similarity or the core similarity or the disease similarity, he means that the simillimum should include even the miasm concern. In the first case of the coma, where the lady was cured by the Herebolus, the primary sora, which was responsible for the high fever and the acute diarrhea, that is the inflammatory stage of intestine, was transferred to the meninges, giving rise to the meningism and later on cloudy sensorium as the disease progressed to what we call as sensorium communis. This was a purely soric derangement of the cerebral functions and of the whole nervous system. There was no destruction whatsoever in any of the parenchyma of the organ. Hellebores was thus not only covering the symptom but also underlying the miasm. Therefore, she responded well. The second case of the coma was having the same symptom, but the underlying cause was malignant astrocytoma. This required a remedy which had a power to produce a growth. This means I required a sauropsychotic remedy. Belladonna does not have the power to produce astrocytoma and hence cannot cure astrocytoma. nor does Herbaceous have this capacity. Other remedies in rubric like cuprum or zincum could have been indicated, but here I did not use my judgment, as mentioned by Hahnemann in aphorism number 177. I did not use the symptom well to prescribe and stuck to the homeopathicity. The miasm or the cause of the disease was not covered and hence it was not homeopathic phenomenon. It is so happened that the mother with their precious children visit our clinic again and again for the same old bronchitis, wheezing and fever relapsing at the slightest indiscretion in the food or the change of the climate. We take the mentals, physicals and the generals into considerations and we leave the child to give a result much faster and quicker than the contemporary medicines. The mother happily comes to us because of one advantage. Mild child does not become cranky or lose appetite when on your treatment, as it happens with the antibiotic, is her contentions. This is what makes her stick to us. But she says, can't you eliminate my child's problem permanently or comprehensively? Instead, we go on prescribing the patient goes on getting relief, he goes on relapsing, and we goes on changing remedy and goes on giving excuses or rather blame the patient for not maintaining the dietetic restrictions or other precautions. This is on the part of homeopathy. But the result is the patient is stuck to you for years. This is not only in case of bronchitis. Same vicious cycles of the chain of events are seen in patients with the arthritis or with the migraine or with the cases of the mental depressions or any other chronic ailments. This leads us naturally to think, is homeopathy is insufficient or incomplete science? Are the limitations of the homeopathy the same as its counterpart allopathy? Is it only mean to cure a simple illness, or do the disease like arthritis, migraine, hypertension, diabetes, behavioral problem, depression, cancer, psoriasis, etc. still belong to the list of incurable as in the allopathic treatment? 200 years back, Hahnemann faced an identical problem and he had discovered homeopathy, and homeopathy was his baby. The credibility of his discovery was at stake. So we conclude reading of this up to this. From tomorrow morning, we're starting with the Hahnemann's dilemma and why Hahnemann has found this science to and why Hahnemann has given the idea that my discovery of homeopathy is not important than the discovery of the chronic disease is most important. So he categorized disease in these three categories: the psoriasis, psychosis, and syphilis. So whenever we are treating any disease, we need to understand the things that we have to take care into considerations that you need to make understanding of the disease in terms of miasm, and when you understand the miasm in the proper sense, then and then you can understand the disease in a proper sense, and then you prescribe. So we have seen the case of coma, the same symptomatology with the different cause, so we have not treated that. Okay, so you have to understand this in a better sense. Hope you all have idea of reading these books and you have get all these things. Any questions, you can put it into chat box so we can have a little chat for 4 5 minutes. Any questions? Write it in the chat box. From where we can buy those books? You can contact Dr. Predictive Homeopathy. I will share one of the number of the predictive managers, so they will get back to you with the books. Mr. Amit Day from the Predictive Homeopathy. So you will get that books and read it diligently, so you will get it done. Any questions? So we call the day today. Thank you so much. This is what the introductory part. So when we are updating ourselves gradually, we will improve day by day. There are many questions in the WhatsApp group that we cannot join. So those who have joined, they have to log into Zoom account. There is a limitations of the hundreds in the Zoom meeting, even though I have upgraded the Zoom. So yes, Dr. Monica, I will get back to you with your case. Yeah, great. So thank you so much. Uh, from tomorrow on the mornings, you are requested to join early as possible. So we have a limited number, 100 numbers in the Zoom. Okay, I will look into Zoom. So if it is possible to upgrade more than 100, so look into that. And if it is not possible, so we'll get back to something different. Okay. So thank you so much. Thank you all. Thank you. Unmute Dr. Rashmi, unmute yourself.
Thank you, Dr. Gohel. Thank you so
Thank
much.
you. Thank you. Thank you. Thank you. Thank you all.